In your Health Watch this morning, you know, it seems lately like everybody is getting sick. And listen to this, if Australia is any predictor of what could happen here, Dr. Ken Redcross is joining us to say we had better prepare for a flu season like never before. That's pretty scary.
Yeah, you're right, Olivia. And so each and every year we're always ready for what I call the winter woes. But this year is a little bit different, so I want to make sure that everyone is tuning in.
Okay, so that's an indicator because they're getting their flu season earlier than we will. And we know that it's been, I guess, maybe a little bit resistant to the vaccine and fairly severe.
Well, yes, and every time we look in the southern hemisphere to see what's kind of coming up to the northern hemisphere, so that's how we decide how to get ready for our flu.
Okay.
But the good thing is this, we do know there's some common winter ailments that are going to come. But my thing is, let's stock up with some of the things that we'll talk about today so that we're ready and prepared. The CDC already said 35 million illnesses each and every year result from the flu itself.
Okay. So what should we be getting?
So the first thing we should think about is, obviously, as we think about the flu, we know the symptoms, right? Fevers, chills, but it's those body aches that we really need to be careful of. It's also the dreaded complication of pneumonia, what we get from influenza as well. So we need to be on top of that. So the thing we can consider is there was a new study in the journal called Cell that showed that a modified omega-3 or fish oil was actually beneficial.
Oh, okay.
So I talked to patients about that. Another thing that I really love is actually a low-cost homeopathic remedy called oscillococcinum.
It's the tricky one to say, but it's good for you.
I've practiced, Olivia, because it's so important.
We'll leave that to the doctor to say.
There you go. So oscillococcinum is interesting because not only does it help with the severity and the duration of illness, but I love the fact that it's mobile, it's portable, it doesn't require any water to take a pill.
Okay.
And it's good for my kids who also know that when I'm coming down with flu-like symptoms, I can run and get it. And for the older people, there's no drug-to-drug interactions at all.
Oh, good. Okay, you're going to travel, or wherever you're going, just have that in your bag.
Exactly.
Okay.
Now, the other thing that's always the age-old question, do I get the vaccine or don't I? I'll tell you this year, the vaccine is looking like it may have good activity, okay? So you want to make sure that you're thinking about if you're living with older people, even with younger children, and making sure you get vaccinated.
And creating a bubble to sort of protect everybody in the house, right?
Absolutely, absolutely. And I love how the segment showed the importance of hand washing before we started today, because we can't really underscore the importance. The other thing that we'll typically see is a cold. And I love when patients come in, because here's that question, Doc, do I have the flu or do I actually have a cold? I know, all over the place. So do your best to think of a cold as upper respiratory. So runny nose, sometimes stuffy nose. That's why the nasal saline is very beneficial. You'll see a common theme here, guys. We're trying to stay as natural as we can to make sure that these things can get a little better. The other thing you could do, come into your doctor's office and get tested. See if you have the flu or not, because that'll make a huge difference also.
Oh, okay. And is that just a swab or blood test?
It's a swab in this case, and so it makes it easy, not too long to wait for the results.
If you do have the flu, do you recommend the Tamiflu?
Oh, very, very tough question, because you have to be within that 48-hour window, and that's tough, right? Because we feel bad for a few days, and then next thing you know, we're outside that window.
Okay, Dr. Redcross, just as we wrap up, apple cider vinegar.
Yes, because as we talk about sore throats, two important things. Apple cider vinegar has been shown to be beneficial if you gargle it. It makes an acidic environment, which makes it tough for those bacteria and viruses to do well. And last but not least, honey. Once again, very natural. Honey is an antibacterial and is also an osmotic. So an osmotic is important because it pulls that liquid out of the throat, which is that swelling that's making us feel the pain.
You're so helpful, and it's great to see you in from out of town, so he's going to stick with us and will visit us in the next hour as well. We'll talk about working out only a couple days a week. I think I like the sound of that.
I like that.
Thank you, Dr. Redcross. Let's head on into the other studio. Heidi covering for Gina on traffic.